Welcome back to the Radcliffe's Next in Climate Change program. We now have the privilege of hearing from two more exciting speakers. Our first presenter in this segment of the program will be Amruta Nori-Sarma, Assistant Professor, Department of Environmental Health, Boston University School of Public Health. The title of her talk will be How Climate Affects Our Mental Health and Well-Being. After Professor Nori-Sarma has concluded, we will hear from Joan Casey, Assistant Professor, Department of Environmental Health Sciences, Columbia University, Mailman School of Public Health. The title of Professor Casey's talk is Blackout, Power Outage, Distribution, and Disparities Nationwide. As I mentioned earlier, there's a lot more about these speakers on the webpage. Please, I encourage you to look them up on the webpage. And as a reminder for those online and also the participants in the audience to add all your questions to the Slido link that's provided on this graphic as well as in the chat feature of Zoom. And it is now my pleasure to invite Professor Amruta Nori-Sarma to the podium.
Thank you so much for that wonderful introduction, and thank you for the invitation to speak today. I'm really excited to be sharing some of my work around the health impacts of climate change, and specifically I'm hoping to walk you through some of the global perspectives that I've gained through my research that focuses on both the physical and the mental health impacts of different extreme weather events that are associated with climate change. And it's a really exciting time to be in this field. I know that a lot of the talks have focused on some of the disastrous impacts of climate on ecosystems and on economics, and I'm no different from the track. I'm going to be talking about some of the devastating impacts of climate on health outcomes as well. But the reason why I say that I think it's an exciting time to be in this area and in this field is because I've seen over the last few years that there's been this recognition and this changing recognition of the health impacts of climate change, and there's such a groundswell of support in our field and in our discipline of folks who are really enthusiastic to try and tackle some of these problems and some of these challenges. And I consider myself really privileged to be among the few that are able to address these research questions. So I'm excited to share this work with you today, and I'm really, I'm really hopeful that a lot of conversations will come out of this. So I really look forward to your questions as well. And so first, I just want to provide you with a brief outline of what I'll be talking about in the next few minutes. I'm going to be talking about some of the work that I've done in a variety of different contexts, both in the US as well as globally, on the physical impacts of heat particularly, but of climate as well. And then I'll go through some brief late-breaking research. We just had a paper that was published last week, in fact, on the mental health impacts of extreme temperatures. And then I'd like to, go through, okay, so what can we do about this, really? What can we do about these problems? So we do know that climate change is a threat to physical health in many different ways. There is an existing body of research looking at the physical health impacts of extreme temperatures as well as a variety of other natural disasters that are associated with climate. And we know that temperatures can impact, for example, heat stroke, heat stress, and a lot of other direct effects that are associated with extreme heat exposures. But we also know that heat has the ability to trigger exacerbations of underlying health conditions. So some things that we might not necessarily think about as straightforward impacts on health of extreme heat exposure, like, for example, exacerbations of renal insufficiency. And a lot of the research that's coming out of our group has been demonstrating the impacts of these extreme environmental exposures on health outcomes across different health endpoints, but also across the lifespan. We know that this is a problem not just for elderly adults. We know that it's also a problem for children. We know that it's a problem for adults of all ages as well. And in particular, we know that there are vulnerable populations both across the United States and across the world that are experiencing the brunt of these environmental exposures and that are also disproportionately impacted from a health outcome perspective. So we know that communities that are relatively lower income, we know that communities that have concentrated elderly populations, and we know that children as well are particularly vulnerable to these adverse health impacts. And so some of the work that I've previously done has focused on the context of India. And I like to bring this into this overall research agenda for a couple of different reasons. I think India represents a place in the world that currently sits at the intersection of very, very large vulnerable communities, the concentration of poor or low-income communities in urban centers that are experiencing very dramatic exposures to extreme temperatures and air pollution. And also, I think that it represents unique challenges for public health research. So one of the things that's really important when talking about this research agenda is where is the data coming from? And what are the data sets that we can really use to start to understand how the climate is impacting health outcomes? You know, we might think of, causal effects of extreme environmental exposures, but you can't really randomize people into extreme temperatures. You can't randomize them into a hurricane or a storm or a flooding zone. So we really have to use observational studies in order to try and estimate the correlation between these high environmental exposures and the health outcomes that we observe. And the reason that I'm super proud of this work is because we were able to access and leverage local data resources from these different communities. Here I present 4 different communities, including the large Indian metropolitan area of downtown Mumbai, in comparison with a village in northern Rajasthan called Churu. And what we've been able to do is leverage data that was collected for the purpose of property transfer as part of the Indian Civil Registration Act of 1952 on the numbers of mortalities that are occurring in these different communities on a daily basis, and use that for epidemiological studies that might not otherwise be possible in this very resource-constrained environment. And the other thing that I'd like to highlight from this figure is that one of the questions that I'm consistently asked is, well, aren't people in India already used to those extreme temperatures? They experience them on a regular basis. And what we're able to show here is that even in these communities that already have higher baseline temperatures, as we get to the more extreme end of the temperature distribution into the 40s and 45 degrees centigrade, which is up above 100 degrees Fahrenheit easily, we see that these communities are experiencing elevated risk of mortality. And that's across all of these different communities, whether you're in the main cities or you're in the villages of India. And I think that there are lessons that can be learned from this work that's done in these resource-constrained environments that are currently experiencing some of the warmer climates close to the equator that some of the higher latitudes might start to experience in the coming decades under a climate change framework. So if we're thinking about policy-relevant examples, we don't have to actually look to the future. We can look to places that are experiencing these extreme environmental conditions today. And one of the things that I have been really excited to be a part of is the development of plans in order to try and mitigate the health impacts of some of these extreme environmental exposures. So one of the best examples is heat action plans. And I worked as a Fulbright Fellow in India in 2012 and 2013 to develop and implement the first heat action plan in South Asia, which was in the city of Ahmedabad in the state of Gujarat. And one of the key questions that we were interested in, and that has been, replicated throughout my research ever since, is do heat action plans actually work? And if they do work, for whom do they work? And how can we continuously evaluate those heat action plans to make sure that we are continuing to improve health among those who need it the most. So I've done this work in India. I've looked at South Korea as another example of communities that have really excellent heat action plans that have been ongoing since the late 2000s. I've looked in New York City. There are communities across the United United States that have heat action plans as well. And the reason I wanted to highlight this is because I think that there are also opportunities to bring the lessons that we've learned from the development and implementation of these heat action plans in different contexts in the US and around the world, and bring those to the development of new plans that can continue to be health protective in a variety of different settings as we go forward. But it always should rely on this local data collection and should be informed by the communities in which these heat action plans are intended to be implemented. So next I want to focus a little bit on the mental health component. So while we do know a lot about the physical health impacts of extreme heat and other types of climate exposures, relatively less is known about the specific mental health impacts of climate change. So my recent work and the recent work from our group aims to understand the impacts of climate on mental health from a variety of different exposures, as well as across an array of different health endpoints. And as I mentioned, we just had a paper that was published last week, and so I just wanted to walk you through the results of that paper, because I think it provides a really illustrative example of some of the opportunities for this research, but also some of the inherent challenges of this research as well. And so our new study was able to leverage data on commercial insurance beneficiaries across the entire United States from the period of 2010 to 2019. And we focused on the summertime because we're really interested in the heat impacts on mental health. And so here in the figure, I show the number of emergency department visits at the county level across the entire U.S. We have a little under 3.5 million emergency department visits that are associated with any mental health cause among about 2.2 million beneficiaries across this time period. And here what I show is the 95th percentile of daily warm season temperatures for each of those summertime periods by county. And what I think that this represents is that the United States is a very climatologically heterogeneous place. We see a wide range of the maximum temperatures in different regions across the US. And this is an important thing because it can be very difficult to conduct research that is across the entire US, taking into consideration that same thing that I mentioned before, which is that different populations might have different levels of adaptation to different temperatures based on what they are experiencing on a daily basis historically. And interestingly, what we found is that there was an elevated rate of emergency department visits associated with any mental health cause, pretty linearly associated with increasing temperatures. And this was true for a composite indicator of all mental health claims that are included in our data set. And it was also true for specific health endpoints that might be of interest. So here I show, for example, substance use disorders, anxiety and stress disorders, mood disorders, schizophrenia, self-harm, and childhood onset emotional and behavioral personality disorders. And what we see is that there's a relatively consistent trend for all of these different health endpoints. And what that suggests to me is that heat is an external stressor that's exacerbating existing mental health conditions. So this means that people who have underlying mental health illness are going to be experiencing additional stress and additional strain on their individual health as a result of continued warmer summer temperatures in the future. And interestingly, what I want to point out is that we looked at the heterogeneity of these effects for different regions across the United States, because again, as I mentioned, the US is a very climatologically heterogeneous country. And what we found is that the places that you might not think of as having the warmest temperatures, for example, the Northeast, the northern part of the Midwest, and the Pacific Northwest, had some of the higher rates of emergency department visits associated with increasing temperatures. So we might expect that we see higher temperatures in the US Southeast and in the Southwest. Why is it the case that rates of emergency department visits for mental health are higher in the northern latitudes? And it turns out, I believe, that what this is indicating is that people in those northern parts of the US aren't as used to those extreme temperatures and don't have things like higher penetration of air conditioning to cope during those times of extreme heat. So I think that this, again, goes back to taking the lessons that we've learned from places that are currently experiencing warmer temperatures and applying them to other parts of the world that may start to see some of those higher temperatures in a climate change framework. So one of the things that I also wanted to point out, as I mentioned towards the beginning of my talk, is that there's been an increasing recognition of the health burdens of climate change that are important to consider and important to address as we start to move away from understanding that climate change is existing and is a problem and towards, okay, well, what do we do to try and resolve this issue and try to solve this problem? And, you know, the IPCC report recently has been releasing part of their 6th iteration of their ongoing reports. And in the initial summary for policymakers, which is kind of the front matter of the IPCC report, mental health is mentioned 147 times in the document. And one of the things that I think is really interesting is that this is a marked change from previous iterations, even of the IPCC's own documents, because we do know that mental health is an issue, but we don't have a lot of data going back for many years in order to understand how big of an issue it is. So I think that that points to the need for further research in this area, because climate change is not something that is going to cause health impacts in the future. Climate change is something that is already causing health impacts today, and it's causing impacts on an array of different health endpoints, both physical and mental. So finally, I just wanted to end on the note of, well, what can we do about it? Sorry. And I think that there are a couple of different answers to this question, and I know that some of my colleagues probably have further insights into this as well, but I just wanted to give a little bit of my take. So I think at the individual level, it's really important that we understand that there are going to be these health impacts, and take care of ourselves, take care of our loved ones, and take care of our communities. Time and time again, we've seen that these social networks are some of the best ways to make sure that we're able to cope during times of stress and during times of extreme strain. At a community level, I think that it's important to highlight that we need to provide access to resources for those who are the most vulnerable to the burdens that are associated with climate change. And from a societal level, I think it's really important to support efforts to disengage from fossil fuel consumption. I think that's going to be one of the major ways that we can start to deal with the health implications of climate change, and both now and into the future. So with that, I'll just wrap up my talk, and thank you once again for the opportunity. I'm very happy to take any questions, and I'll invite my colleague, Dr. Joan Casey, to come up to the podium.